I keep coming back to, are we all, sorry, I'm so self-centered here. So for those people who are going to be getting insurance and they end up working with a company that doesn't provide insurance and they're going to these exchanges, which apparently will not look like everybody's in gray and scary, but you're paying for it all by yourself now, right? Your company's no longer helping you pay for it. So is there going to be a significant difference in the price of insurance then? If a person's used to paying in, for the sake of argument, $150 a month, I have no idea what people are paying, but let's pretend it's $150 a month toward their insurance, and it's understood that the business owner is putting in 2/3 of that and paying X amount of dollars. If suddenly the business owner isn't paying the insurance and I'm going to the exchange, am I now absorbing the entire cost of insurance?
For people, for lower income people, no, there will be government subsidies to help them. They only pay up to a certain percentage of their income. And
So it's going to be based on income?
And it'll be a sliding scale based on how your income is, up to 400% of poverty.
Huh.
So there will be some. So again, the penalties again. I think the penalty is probably the most important part of the whole bill, and how you're trying to incentivize the things to work. That it is a small penalty for the employers, but the thing is to try to keep. It's more of a nuisance tax to keep them from dropping coverage, because really can't. The funding under the program just couldn't afford to pay for this if all employers just dropped coverage and everybody went into the exchanges and had the government help subsidizing it.
So the other part of it is that there's the hope, depending on how the exchanges are set up, right, that we're going to be pooling more people.
Yeah.
People participate. You know, if the rules are set in such a way that selection doesn't happen, there is a hope, I think, an anticipation that in fact the prices will be, you know, if not lower than they are now, certainly more stable over time. It will be a better purchase opportunity for small employers and individuals than they have right now. I mean, that's
Right.
the other piece of it,
Right.
Even if you're not getting subsidy. That's
Okay.
the concept.
Did somebody want to say something?
I wanted to mention something about vouchers.
Okay, let's let Jay speak and then you. Go ahead.
There are certain employees that will qualify for a voucher from their employer. They can take that voucher, they can only use it at the insurance exchange to purchase coverage. If the coverage is more expensive than the voucher, the individual must make up the difference. If the voucher is more than the cost of coverage, then the employee gets to keep that difference, to pocket that difference. So they may not have to bear the full brunt of cost themselves if they're eligible for a voucher through their employer.
Interesting.
So, and there's here's a wrinkle in this, that you're talking about the impact on employers. So let's say you as an employer provide health benefits for individuals, and you're going to keep them. You're not going to opt out and just pay your $750 tax. You're going to keep benefits. Well, the law requires that you provide coverage for everybody. And some health plans that employers have, individuals can say, I don't want your coverage, and they just go without insurance, because we don't force people to accept our coverage sometimes. So the law would say then that you actually have to provide coverage to everybody, even if they don't want to. In fact, there's a change that says you have to make it an automatic opt-in rather than a voluntary opt-in for health benefits. That ties in with the voucher piece, because let's say you're now mandating that if you can get coverage and your housekeepers don't want it, they still have to buy it. Well, then they're going to say, well, I'd rather have your voucher maybe, because it costs me less to go to the state. And so you're now going to be paying for people who you might not already be paying for, either through they're a part of your plan or they're getting a voucher from you. So that will also potentially impact cost to employers, because you're going to be paying for people who might have otherwise just opted out of having health insurance.
Okay. Oh, actually, you had raised your hand, I promised.
Well, you talk about the nuisance tax.
Stand up and say who you are.
$750. We have about 1,500 seasonal employees that we're going to have to rope into this. So, as we analyze this, it's cheaper for us to drop the health plan, pay an additional $20,000 to $30,000. You talk about sourcing talent, pay them a higher salary to get them to come work for us, and not have to pay for those 1,200 seasonal employees that now 30 hours or more a week that we may only have for 8 months out of the year. Rope those into our plan. What's the consideration for the seasonal aspect of it?
Oh, I love when the panelists go, that's a great question. We'll be back tomorrow.
We have panels covered, now we do have to cover. It's 100% cheaper for us to just drop our plan without even a question.
I think the simple answer is they'll probably go to the exchanges. I think that's how it's set up. I mean,
One thing to keep in mind, this Health Care Act, which is actually two legislative acts. It took a long time to pass and a lot of negotiation. The way the penalties ended up were not the way the penalties were originally written, and may not be the way the penalties are come 2014. But this is how it got through.
Okay. Did you want to say something before I call in another person?
Yeah, just to answer.
Yeah.
There's another wrinkle in the health reform bill that there's a Medicaid program that helps cover lower income people. Under this, it expands this. Right now, there's categorical people where only kids, pregnant women, and disabled people can get on it. Now they're going to expand that to all adults, up to 133% of poverty. And there used to be an asset test where if you had more than $2,000 in assets, you usually couldn't get on. That's now removed. So for your seasonal employee, say he works 6 months and he makes $50,000, in the next 6 months he doesn't have any income at all. He could qualify for Medicaid because he'd be below 133% poverty and be certified for 12 months. So he could constantly be on Medicaid with the fully government financed and not really need to have health insurance. And you wouldn't pay a penalty for him because he's not getting a subsidy through the exchange.
Gentleman in the back, please stand up and say your name.
Familiar with the?
No, tell him to stand up. Okay, thank you.
Is anybody familiar with what was voted on in Missouri? Is that the same issue that Virginia raised? And
Yes.
It was interesting
Yes.
that it was apparently like 3-1 or something.
71%.
Okay, no insider baseball. What just happened? What did he just talk about?
So the thing I talked about.
No talking over the moderator's head.
Yeah, so the thing I talked about Virginia around the large.
Oh.
Mandate was actually on the ballot, not binding. Obviously, this is a federal constitutional question. So
Okay.
the Missouri state voters voted and said, we don't like it either.
Got it. Okay. Sir.
They were 71% against it?
Correct.
He was talking about a seasonal employee. I'm on the board of a company that's about 1,500 employees, $500 million in revenue, nice sized company. And they've done their analysis, and their conclusion is that it would be, when they have self-insured up to a limit, they have all that coverage. Their conclusion initially is to drop health care for their employees. And these are high-tech and well-paid employees. Because of the excise tax. It will be the company will benefit more by increasing salaries, dropping health coverage, and sending everybody to the exchange. That will be, unless something changes. And this is a company that supposedly has to compete for talent. And to me, it sounds as if it's just a mechanism by which business supply health insurance to do.
I think the interesting question, though, that I pose is, why don't they drop the coverage now? It's interesting. I think as you get closer to the 24 deadline, we can do the math and do the calculations and say, gee whiz, it's better financially. But I think there will be ultimately an employer human resource question, back to the point we heard earlier around the talent. And you're going to have employee relations issues too,
Right.
I think. I think it's not quite as simple as it's going to save us money.
I have to ask you a question since you're Kaiser.